Mass protests are sweeping across the Bay Area over police violence, but as demonstrators stand shoulder to shoulder, a new threat is emerging. Joining us now by FaceTime is Dr. Stacie Vilendrer with Stanford Healthcare to talk more about the coronavirus. Great to see you. Thanks for joining us. We've seen a lot of people turn out for recent protests, and there is concern about the spread of COVID-19. How much of a spike do you expect to see in the number of confirmed cases?
You know, it's difficult to estimate the exact size of the spike, but we will most certainly see an increase in the number of cases. So one person can transmit the virus to dozens or more of people while they're protesting. The current prevalence is about 3 in 1,000 people, but a lot of physicians and scientists even think that that's an underestimate. So it might even be more. And the activities that you do during a protest, chanting, shouting, singing, all of those things can spread the disease. We have an example in Washington of a choir member who spread the disease to 90% of the choir members. And so we know that those activities are at risk. Fortunately, you can see in the media that a lot of people are wearing masks, practicing social distancing, so that will help. It will also help that people are outside during these protests for the most part. But we really are probably going to see an increase in cases.
Is there anything else that these people can do as they're out there protesting? Of course, they want their voices heard, but many, of course, want to be safe too.
Of course. So following the social distancing practices, I know there was a protest in Oakland where people were in their cars, so that would be a much safer way to protest. Maintaining that physical distancing, sanitizing your hands, face masks, all of the things that we've heard a lot of, those can all help to mitigate the disease spread.
And the Black Lives Matter movement has raised the issue of systemic racism. And many may not think about this, but there are mental and health impacts of racism. Explain.
Yeah, there are so many well-documented negative impacts of racism on mental health and physical health. It can increase rates of depression, anxiety, heart disease, blood pressure. This is just so well documented in the scientific literature. And actually, there's a relationship to the prevalence of COVID-19. We're seeing that disproportionately impact minorities. And, that is the mechanism of that, we think, is just access to employment. So we're seeing people such as essential workers who are having to leave their homes disproportionately impacted. So access to employment, housing, educational opportunities, all of those have systemic racism built into it, and those are things that we need to look at and address as a society. Also, just the wear and tear on the body of the stress of racism can make one more susceptible to infection.
And we're showing video, of course. We've seen cases of looting and some cases of riots as well across the area. How can that impact mental and physical health?
Well, of course, just the physical risk of harm that can happen at a protest. Hundreds of people have been injured in the last 10 days. I'm aware of at least 12 deaths that are a direct result of these protests. And of course, these all impact people in and around the protests. But there are also other negative health impacts on the mental health, such as depression, anxiety, that impact people that are not physically present at the protests. And there's been lots of studies to show that when there are riots and protests in the community, that can lead to those negative mental health impacts. I will say there is a silver lining here, which is I did find 2 studies where because people came together and had their voices heard, there was actually a decrease in suicides and depression. And the authors of those studies really thought it was just related to people coming together, having their voices heard. It's going to be challenging to understand what is a result of the COVID pandemic in terms of mental health impacts versus what is a result of the civil unrest, just because they're both going on at the same time. But we will see negative impacts from this.
Something else we'll have to watch and wait and see. Dr. Stacie Vilendrer with Stanford Healthcare, thank you so much for joining us.
Thank you.